If you suffer from what's known as osteoarthritis of your knees, you're not alone. 33 million American adults suffer from this as well. We're focusing on a treatment for it. With more on this is North Shore neurologist Dr. Chad Domain to break it down for us. Thank you so much for joining us as usual.
Good afternoon. Always a pleasure. Thanks for having me.
Okay, so what causes this problem in the knees?
Yeah, so again, I grew up in South Louisiana like the rest of us, and I think I can give you numbers just like you did, but who doesn't know somebody with knee arthritis or knee pain? Just to give you some statistics of what you're describing, nationally, it's about 1 out of 6 adults, but in Louisiana, it's more like 1 out of 3, 1 out of 4. And you say, well, what's the difference? Well, number one, we have a very blue collar society here, but number two, we have a lot of obesity. And obviously, the more pressure you put on a knee, the worse it is. This is a really interesting statistic. For every 10 pounds you are above your ideal weight, your chance for osteoarthritis of your knee goes up 30 something percent. It's unbelievable how much our weight puts on our knees. And it's just a wear and tear. It's a mechanical issue. The knee wears out, the weight, the labor that a lot of us do in our daily activities at some point wears our knees out.
Well, yeah, that's a good explanation as to why you see so much of it here. Talk about this nerve knee procedure.
Yeah, so I have a model here. This is a knee replacement model. We're not talking about knee replacement, but it gives you an idea of the anatomy. So the knee is a hinge joint, obviously allows us to bend and twist. The normal type of things we do for knee pain, the simple stuff, physical therapy, anti-inflammatories. If you see an orthopedic surgeon, they can inject the knee. They could put a lubricant called a Synvisc, which is basically a DW40 for a knee. When all those things fail and you don't want this metal, which is a knee replacement, or if you had a knee replacement, you still have pain, we can do a procedure called a rhizotomy where we burn a nerve called the geniculate nerve that sits right here on the femur and on the inside part of the tibia. And we use a needle which has a tip that's uninsulated, and that needle will sit on the side of the bone and it'll heat up. I'll connect it to a generator and it will burn that nerve. And by burning that nerve, you make it so the patient doesn't feel the arthritis. Now, I know when I say nerve burn, people immediately freak out and say, that means I can't feel my knee, I can't move. This nerve doesn't serve any major function. So by burning this nerve, you don't lose strength. You can still feel your knee, you just don't feel that deep down ache that these patients feel when they're moving and they're trying to be active.
So, which patients would qualify for this?
So these are patients that have failed physical therapy, failed weight loss, failed anti-inflammatories, topical creams, knee bracing, maybe steroid shots, the lubricant you and I discussed. So I always look at it as a step before you're talking surgery, or someone who's had surgery and still having pain. As we all know, surgery doesn't always make the world go back to normal. So these are the type of patients we look for. And the nice thing is, before we burn the nerve, we do a test block. So we numb it up, I go see the patient after, and they get to tell me, so right, either it works or it doesn't. This is a very simple procedure, outpatient. It literally takes me 8 minutes to do this procedure. And what I always tell people is, if it works, great. If it doesn't, you can always get surgery. That's always on the table. I just look at it as a less invasive option before you start doing things that have, one-way streets, irreparable type damage.
All right, so my last question to you, once you have this, has it shown to be the solution for people? How soon are they back up and running?
So it's an outpatient procedure. There's no restrictions. So regardless of the pain they feel or don't feel after this, I always tell them to be as active as possible. A lot of times people are sore just from the needle entry, the soft tissue type stuff. We put a little numbing medicine and steroid after we burn the nerve, so that does help. But again, there's no restrictions, be active, and it kind of delays the surgery. As a knee wears out, this procedure will sometimes stop working, and then, surgery obviously is the option then. But if you can buy someone 5, 6, plus years before they get a knee replacement, why not?
Why not? For all those suffering with those knee problems, it's something to consider. Appreciate your scientific input today. Always. Have a great day.
Always a pleasure. Take care, guys. Y'all be safe.